All right. Hi, everyone. Welcome to another session of Public Health 101. Today, we are going to be hearing about the Project Firstline Rhode Island program, and Karina is going to be giving some more information about that. So Karina, if you'd like to introduce yourself and get started.
Morning, everybody. My name is Karina Descartes. I'm the team lead for Project Firstline Rhode Island, and I'm going to be sharing more about Project Firstline today. And I'm very excited to be here. Some of our team members are here. Thank you for coming, and those who are visiting with us today to attend this Public Health 101 series, thank you for coming. I'm going to share my PowerPoint. So the name of the project is called Project Firstline Rhode Island. Again, Jen, thank you again for hosting this session. I forgot to mention that earlier. So I'm going to be talking about basically the principles and implementation and management behind the program, but at the same time, I also want to introduce what is Project Firstline, what is Project Firstline Rhode Island. So of course, we're going to talk about what is Project Firstline, and then I want to introduce Project Firstline Rhode Island. I'm going to show you some things of what we're doing, and then we'll go to the sort of main part of our presentation, focusing on the key public health tools and principles that went into the implementation and management of this project. Those are the adult learning principles come into play in this project, implementation science. We're going to look at it, what's the difference between implementation science versus performance improvement, for example, public health communications. And of course, I want to highlight, the sort of umbrella principle here, which is project management. And then hopefully we'll have some time to answer your questions. And if I can't answer them today, then I would love to connect with you offline via email or via chat. So what is Project Firstline? Project Firstline is a CDC-funded national program. It's an education and training collaborative for healthcare infection prevention and control. You can see it here in my logo right here. So CDC partners with multiple states and jurisdictions and organizations as well. So Rhode Island is one of the partners. Other organization partners are organizations like American Association of Pediatrics, American Nursing Association, for example, American Association of Family Practitioners, American Hospital Association also has a Project Firstline component and partnership in that organization. And Project Firstline, because it's an education and training program or project, but this is unique in a way and very apt because it is intentionally designed for adult learners. The population of focus here is healthcare workers, whether you're in clinical or non-clinical function, as long as you work in a healthcare-based setting, this is who it's designed for. The education and training materials are designed for adult learners. And as I've said, Project Firstline is a partnership-based endeavor, and the Center for Acute Infectious Disease Epidemiology is a collaborative partner with Project Firstline. So Rhode Island Department of Health, through the Center for Acute Infectious Diseases Epidemiology, collaborates with CDC Project Firstline, and this is where who our team reports to. So we report to CADE, we report to the center, and more about this in a short bit. So what does Project Firstline do in general? The goal is in all jurisdictions, Project Firstline Rhode Island in particular, we want to protect individuals, families, and communities from infectious diseases threats. And our major tool is infection prevention training. We focus on individual healthcare-based workers. Like I said, whether you do clinical work or non-clinical work, as long as you work in a healthcare-based setting, these educational materials are for you. We want to focus on building the individual capacity of the healthcare worker or strengthening that individual capacity in order to best prepare the healthcare worker from various infectious disease threats. As I've said, we focus on individual healthcare-based workers, and these are just an example of the topics that we cover in our training materials. So various infection prevention and control topics focused on preventing healthcare-associated infections. And we now move on to our introduction to Project Firstline Rhode Island. This is our website right here, projectfirstlinerhodeisland.com. If you go to the website, what you will see first is this one. This is our landing page, and you have some options. You can either reach out to us or click on the training and resources and so forth. You can learn more about Project Firstline and Project Firstline Rhode Island as well. And so if you have time later on after this session, please feel free to check out our website. And if you click on the training and resources, it will bring you to the various offerings that we have. So we have some self-directed online training. You can earn CE credits if you're in that field, whether nursing or dentistry or whatever health profession, whatever health professions that require require you to get continuing education credits. We offer that as well. So these are online training, self-directed, focus on infection prevention and control. We also offer live Zoom trainings in various lengths, but no more than 60 minutes. And this is by intention because we are mindful of the busy schedule of healthcare workers. This is the Project Firstline operational structures. This is our team here. As you can see, we are a very small team. And as I've said earlier, we report to CADE leadership. We are also supported by RIDO communications experts. So we work closely with them. We work closely with a communications manager. His name is Aaron Fischette. I'm giving a shout out to him here because he has worked with me. We have worked together since the beginning of the implementation of this program. We also work with a communication specialist who help us with our social media campaigns and other community communications campaign. We also work with a marketing vendor, and this is an external company that works closely with our communications manager as well. So for example, our website that I have just shared with you in a few slides back, we've worked with a web design team for that under the marketing vendor and the communications experts at RIDO. And we have done quite I think 4+ months of work on that one. So we're very proud of that work. And that's a big aspect of what we're going to talk about too in the succeeding slides. We also work closely with CDC Project Firstline team. So this is the team that approves our courses that we develop in-house within the Rhode Island team. And CDC provides the guidance and the parameters so that it aligns with the core material and core principle of the training in infection prevention and control under this project. And we work with internal partners. Typically, these are subject matter experts, points of contact, leadership, or we also work with external partners. Either they are from the learning community or the community in general. We also work with external partners who are subject matter experts in infection prevention and control. And then these are our team members. We are, as you can see here, we are a small team, and I'd like to highlight the multidisciplinary aspect of our team members. So each of us bring, different specialties, different fields coming in to the project. So most of us come from the clinical world, but some of us are, and some of us don't. But like I said, the multidisciplinary is key here for this project, as it allows us to look at our education and training materials from different lenses. So for example, we have Abby here as a project assistant, comes from training in health sciences and public health. And Dora here is our community liaison, but is also works as a disease intervention specialist with the Center for Acute Infectious Diseases Epidemiology. And she also, her background is she was a school teacher once, and she was also a member of the U.S. Army at one point before coming to the Department of Health. And the two infection prevention training liaisons that you see here, Lisa and Allie, they are nurses, and they come from a broad range of nursing background, including leadership and management from different facilities in the New England area. And of course, we have our consultant medical director, Dr. Kearney, is an active emergency medicine specialist practitioner and who also has background in education and global health activities. I come from general medicine as well. My background is as a general practitioner. I come from another country, coming into the United States. So I've worked in various countries, in low and middle income countries, in humanitarian settings and contexts. And I wear many hats. So in the US context, I have work background in healthcare quality, infection prevention, and education as well. And then we'll go to the main part of our presentation this morning, which is the principles, implementation, and management that went into Project Firstline. So I want to highlight 3 key tools and principles that we use here to implement this project. Adult learning principles, performance improvement, PDSA, I'll talk about that later, and then public health communications. So in adult learning, I want to touch upon andragogy. It's just a different term. It's just a fancy term for adult learning. So it's an adult learning theory and principle. And then we also have train the trainer underneath adult learning. And then performance improvement is different from implementation science, but they are related. So we want to take a look at the definitions of that a little bit. Not too much in detail, but just to kind of bring that up in your radar, so to speak. And then we talk about public health communications. So first we talk about adult learning. Andragogy is the method and practice of teaching adults. So simple, that's a definition. A gentleman in the adult learning circles or in the learning circle that time, I think early 80s or late 70s, his name is Malcolm Knowles. He developed the theory of adult learning. However, the first person documented as the one who kind of highlighted this theory is another gentleman named Alexander Kapp, and this was decades before Malcolm Knowles. I want to highlight here the key characteristics and assumptions of the principles of adult learning or andragogy. So now the first one is self-directed learning. So this relies on the premise that adults thrive on self-direction, right? So we don't want to be told what to do, right? So for example, the process and principle of online learning is an excellent tool for self-directed learning. And that's why, as an example here, we did a learning needs assessment way before we piloted some courses for the healthcare worker community. And one of the highest responses that we have options that was picked was self-directed learning. And so this is an example and to affirm this key assumptions in the principle of adult learning. And also self-directed, we want to be, as a trainer, as an educator, we want to be supportive of their need for autonomy or control over what they learn, learning schedule. And that's why we make sure that we don't deliver training sessions more than 60 minutes, more than 1 hour at a time, because we are mindful of that need that they have. And also under self-directed learning, the assumption is also mindful of like how they want to learn. So we've asked questions about during our learning needs assessment in the past, before we rolled out this program or project, we ask how they want to learn. So one of the high responses is that Zoom live sessions with being able to ask questions from the trainers are important to them, for example. And then the second one, the learner's experience. The principle here is basically as trainers, as educators, we want to meet them where they're at in their professional stories, so to speak, right? So their experiences, individual experiences, should provide the basis for much of the learning activities offered in this project. So that's key too in the delivery of our training courses. Our job as trainers is to tie their experiences to either the new material that we're presenting or the refresher material or the review material that we're presenting to them. And then the third one is readiness to learn. So the premise here is that learning is best when when the training can help solve an immediate or real life problem for them. So this is very self-explanatory for a healthcare worker. How can I best protect myself from catching COVID-19, for example? So, so that there's a new process to learn, what kinds of PPE to do, new activities from the learning that I, as a healthcare worker, or need to incorporate in my practice. So, and then the fourth one is problem-centered learning. So we assume that the adults learn best when the content is problem-centered. So that's why we have case-based scenarios. If you happen to attend one of our sessions at some point, live sessions especially, we have case-based scenarios at the very end that talk about various experiences, talk about problems in the healthcare setting. And we, through our facilitator, through our lead trainers, we nail down the teaching points in that particular course. So the fifth one is internal motivation. Not that the adults don't have, not that the adults are ideally just intrinsically motivated, but there's also an external motivation, sure. But adults in their, in their study leading up to this assumption is that the best way or the better way to motivate an adult learner is to find their internal motivator. Is it because they need it to get a continuing education, for example, as a requirement for work? Or the typical internal motivators, like they want to feel more confident about a certain skill that they're trying to improve at that point in their career? Or is this training, is this learning opportunity an opportunity to grow professionally, for example? So, and then the sixth assumption is the need to know. Let's see, what's in it for me? So it answers that question. What's in it for the learner? So one way is to share the purpose. So as trainers, and our infection prevention training liaisons always have this at the top of when they develop the courses. We share the purpose of this learning activity via the objectives, learning objectives that we have at the beginning of the course. We present it to them. It answers the question of the learner: how will this learning activity personally benefit me? What's in it for me if I attend this course? So, and then I want to go to the next one, train the trainer. This is the method that we use to train our infection prevention training liaisons to become trainers. So basically, in sum, this is a lot of words in my slide, but in the sum of this is that we want to scale up trainer capacity. So there's a need for this. It has been, and there's a reason for this project being implemented in various states because there is a need for it. So instead of just one trainer talking over and over again to multiple people, we scale up the training process. So we train the would-be trainers. And so it's basically to prepare the trainers to present information effectively and respond to learners' questions. I'm reading from the second item in my slide here, and lead activities that reinforce learning. So when we plan a course with our infection prevention training liaisons, we always end with, we present the concept, we present the practical applications of the concept, and then we reinforce learning in multiple points. And so, for example, that's the conversation we have within our internal team. So basically, we want to ensure that trainers can direct the learners to resources and reference materials after the training session, that they would be able to lead discussions, and our infection prevention training liaisons are great at this, and they be able to listen effectively to the attendees, make accurate observations during the training, and take note of ways to improve. And most important, if not the most important, it's one of the most important aspects in this list, is that we want to help the learners link the training to their jobs. And this is the key point in this principle. The next one I want to talk about is performance improvement versus implementation science. Let's talk about implementation science first. So before CDC released the core materials for this project, the core science, the core training materials are evidence-based to target the best ways to prevent healthcare-associated infections. And so this is where it's come from. So the CDC has drawn from that years of work behind that, right? This is what I want to highlight in terms of implementation science going into this project. And I want to highlight the similarity with quality improvement and dissemination methods. So quality improvement sometimes is interchangeable with performance improvement, which I will explain a little bit more later, because that's the base method that we liberally use within the team. And so just want to highlight the fact that the CDC materials are evidence-based, and this is the principle behind it. Move forward. And then, so performance improvement, PDSA, is a model for improvement, which this is my favorite, because versus implementation science, which takes years, decades, and uses very rigid, and there's definitely a place for that, especially in healthcare change and process and procedures. Let me go back one slide really quick. So implementation science uses mixed quantitative and qualitative designs, and it takes years before you hit sort of like a firm evidence to implement that process or procedure. When you look at performance improvement, it is a simple tool, but effective tool to accelerate improvement of a small project or a big project. You can scale up the small project towards a bigger project if you want to, using this tool. So it is not meant to replace models that organizations may already be using, but rather to accelerate improvement. So for us, what was our use for this one is we use this model towards the implementation of Project Firstline Rhode Island, at the same time towards implementation and launch of each individual course that we offer the community. So the model has two parts and three fundamental questions that we ask each time we release a course. For example, the second part is the Plan, Do, Study, Act. This is the PDSA, and I'll show you later on what the importance of that is in our course release or in our project. So first, let's talk about the three fundamental questions. So in every course release that we release, we ask the question, what are we trying to accomplish, right? So within a training material, we ask, what are the objectives of the course? What are we trying to accomplish? The goal, of course, overarching goal is to protect individuals, protect families, and protect communities. At the same time, we want to touch base with where they're at in their learning of this particular concept, and we want to reinforce that concept, right? The second question, how will we know that a change or an activity is an improvement? So in a course cycle, for example, a training cycle, we have at the back end, we ask pre-session survey questions, and then the activity, which is the training session, and we have the post-session survey, which we ask a series of questions to help us gauge that the course made an improvement in either in their confidence, knowledge, or in their intention to implement a change that they have just learned, for example. And then the third question, what change or what activity can we make that will result in improvement? So we look at this on a micro level, if I may use that term. So for our individual training courses that we release, and we zoom out a little bit, we also ask these three questions when we implemented Project Firstline from the get-go. And then I want to talk about the Plan, Do, Study, Act, the second part of the performance improvement model. So it says here, and I'm just reading from my slide here, this Plan, Do, Study, Act cycle is to test changes in real work settings. It guides the test of a change to determine if the change is an improvement. Using our so our activities, key activities within our team, like the release of a training course, for example. So what goes into that a development of a course is we plan the course as a team. We talk about the framework in the course as a team that falls under plan. We talk about what our teaching points are, what our reinforcement points are, how do we approach this subject matter in infection prevention and control, for example. So we plan and enter, CDC Project Firstline, the national team. They would come in as well and review our plan and see if it aligns with the general principles and implementation tools that align with the national plan. And so and then zoom in again into our training course. And so we go ahead and release that plan, which is our training course. So we release the course, and then so as I've said earlier, we have a pre-session survey, post-session survey, and during our training courses, we also request feedback, like a quick sort of feedback vote from the attendees, and that also gives us data whether they liked the session or not, how they liked it. We give them an opportunity to comment if they care to say more so that we can improve. If they liked it, they can commend us if they want to. And so we study that. We'll look at the data and internally as a team to see not just how we can improve each training course that we deliver. So for the next cycle of the course, or we also try to take a look at that as a as a general project improvement. And then we act on that data that we have collected short term. So it's a good way to test changes and to test little things that you implemented within your team or within the program details that you're trying to release. And then public health communications. So we try to be strategic in our communication. So as an example of this is that CDC Project Firstline provides us with parameters and guidance on how to manage information concerning Project Firstline Rhode Island, including the education and training materials that we develop ourselves or that we co-develop with the national team. So it is strategic because we want to be aligned with the purpose of this project from the national sort of directive. And then internally, we also have our own alignment principles within the team. So we coordinate with individual team members. We are a small team. And so that's the beauty of it's a sweet spot being a small team. There's challenges of being a small team, but there's also sort of a sweet spot of being a small team. We can coordinate quickly, we can align quickly. And then we also coordinate and align with the center who we report to. What are the parameters that we need to adhere to under CADE, for example, and then of course the parameters that we need to adhere to with CDC Project Firstline, as I've mentioned earlier. And then the other principle under public health communications is we strive to be inclusive. Now, to be forthcoming, we have a lot of room to improve for this one, and we are taking steps to improve. So for example, most of our courses are in English, right? So if we want to be inclusive, there's different kinds of groups under healthcare worker in the state of Rhode Island, speaking different languages as a primary language. So English is one and it's majority, but some other languages are spoken as well. So we are cognizant of this one, and it's number one in our item for improvement to have, if not all, some of our courses translated into some relevant languages that are spoken in Rhode Island. So I'm aware that in particular, Spanish and Portuguese come second and third to English in terms of languages spoken amongst healthcare workers in the state. And then the third is storytelling. So this is also an internal sort of decision that we have. The key point to remember here is that this third bullet here. So there's an art to telling a good story, and we all know a good story when we hear one, but there's also a science behind the art of storytelling. when we work as a team with the infection prevention training liaisons and everyone in the team, we encourage the trainers who are the infection prevention training liaisons to share examples of their experiences from, from their previous professional lives. For example, if it's relevant to the courses that we teach. And this is the sort of the tool behind it, or the principle behind why we highlight storytelling as well in our courses. And according to this article, the science behind the art of storytelling is, as you see here, cortisol, dopamine, and oxytocin are released in the brain when we're told a story. Cortisol helps in formulating memories. Dopamine helps regulate our emotional responses and keeps us engaged. And oxytocin is associated with empathy, which is an important element in building and deepening or maintaining good relationships. So, and most importantly, in learning and the principles of learning in general and principles of adult learning, storytelling is central to the meaning making and sense making. And so it's important, and it brings out the humanity in us at the same time, even if we talk about technical matters. And then, of course, the main rationale for also including storytelling in our courses is that we want to meet the population of focus where they are at in their own professional stories. And hopefully, the more it connects with ours, the more effective the material is. And as a PS here, we also have social media campaigns, email newsletters, events. We go to events, we go to conferences. We will try to go to more to talk about Project Firstline, for example. So this is part of our sort of storytelling tool. And most importantly, under public health communications, we are, as I've said in the earlier slides, we are supported by communications experts at RIDO, and we work with marketing and advertising experts. And we enjoy, working with them, and this also helps us improve internally on how is it out there? How is the community responding to the promotional materials that we put out there? And what is the best way to connect with our population of focus, this group of healthcare workers, for example. So we want to connect with them the best way we can. And then and then the communications experts, the marketing experts help us with this intention. And then actually, so I highlighted 3 key principles in that we use in Project Frontline Rhode Island. There's actually a 4th principle, so which is the overarching principle. Of course, it's project management. It's a project, and there are a couple of things that I want to highlight. And we don't usually, when we talk about project management, we don't. Sorry, we usually first try to compare it with project versus program management. There's a difference. So I'm not going to talk about it all. I'm just going to highlight a few points here for us. And so the project management, in terms of day-to-day responsibilities, as you can see here, is an individual project, right? It's an individual team, such as our team. And program management involves multiple, or just a second, my screen kind of out here a second. Hi, Jennifer, can you hear me?
Yes, I can.
I think I might have, at least from my end, I might have been booted out, but I'm jumping back in. Sorry about that.
No worries.
All right, so I'm going to continue where I left off. So,
Perfect. Thank you.
all right, thank you. So as you can see here, so project management different from program management. Project Firstline is a project, it's an individual project and with individual teams, and it is part of a bigger program under healthcare associated infections, antibiotic resistance, which is Project Firstline is only one of the projects under that program. There are 4 or 5 other projects together with that healthcare associated infections program under CADE, for example. The scope of the project, more detailed, as you can see here, is more focused on IPC, on infection prevention and control, learning, and program management. So the healthcare associated infections program has a lot of broader scope than just training and prevention. HAI, or healthcare associated infections, has some surveillance aspect to it, some other aspects to it that are outside the scope of Project Firstline Rhode Island, for example. And the timeline, as an example, so project management has closure, whether it's a phase-by-phase closure or a clear deadline closure. So there's an end to it somehow. There's a transition to another thing, or there's an end to a project. Program for the program, HAI, is an embedded program, and it involves sort of, if I may, multiple tentacles throughout the state of Rhode Island, and with the goal, an overarching goal of preventing healthcare associated infections. So, and the last item that I wanted to, last couple items that I wanted to show, the difference is that, so for tools and methodologies, for example, project management, I'll show you later what methodology we used for this project, and versus, for a program, it's an overall work philosophy or organizational philosophy under that program. I mean, where that program it belongs to. And then the goals. So for project management, there's a project success measured against metrics and milestones. We report specific metrics and milestones to CDC. And then program management has sort of like an organizational vision and mission that they have to adhere to. And then the next one would be, you will hear the phrase in a project management, project lifecycle method. So the method that we use here is called the Agile Method. There's multiple other different methods. I'm just going to focus on Agile. So it's a very simple method. It simply is, the rationale for the use of this method here, for this workflow, is that we are a small team. We want a highest adaptability of the team and of the products, so to speak, the training products that we develop. And so we adapted the Agile lifecycle method of project management. So basically, we trial some things. It's related to PDSA, as I've shown you earlier. We use a lot of trial and error, and we are unafraid to learn new things during the project that will require changes or adaptations, whatever is needed. So as an example, we have some staffing changes from time to time. Sometimes we become a bigger team. Sometimes we are a smaller team. At this point in our project cycle, we are a smaller team, so we're trying to adapt to that one. The third one is that I just want to highlight a few things. I'm not going to go super deep on this one, but just want to highlight that in project management, you will hear the phrase full cycle project management, and there are 5 phases to that. So you initiation, self-explanatory, you initiate the project, sort of like an overall, it includes the brainstorming, considerations and so forth. And then you go more specific, you plan for the project in particular, you now execute the plan of your project, and then once it's executed, once your project is ongoing, you do some monitoring and control. And this is where you can also do a PDSA here, or you can look at some data and see how you can improve and so forth. And then number 5 is a closure. So the project, like I said, has some closure to it at one point or another. And then So specifically for Project Firstline Rhode Island, we work from a work plan. We are now in our second work plan because this is the second cycle that Project Firstline is ongoing. And then in that work plan, there are implementation items that we have to do. We have to recalibrate sometimes. We have to adapt sometimes. And then there are milestones to achieve under that work plan. And reporting is key. CDC requires us to report performance measures. And under that performance measures, the items that we report are, so how many have you reached? How many visits in the website did you record? So our communications and marketing team help us with that. There's also a question there where how many training sessions did you conduct from month this to this? So, and what are the types of healthcare workers that attend your training? So we have to report that to CDC. The process measures is like, where are you at in your work plan implementation or in your milestone achievement? So we have to report percentages and so forth. And then just quickly, want to highlight project within a project. So like I said, the training course is a project within a project, and it has its own full cycle of activities behind it too, which involves the invite to the training session, release of the pre-session survey, the actual training session, the post-session survey, the release of the post-training materials, and so forth. So I just want to share that with you. And then last but not the least, in this section of my presentation is team management. The rationale for adapting a startup culture, what is it first, is that the startup culture is slightly different from sort of a large ship corporate culture. We look at it in this lens. We wanted, because it's from my viewpoint, as a project manager, being a small team, it's easy to have the personalities and passions of the team members come into play in a project. So being a small team, that's again the sweet spot and the advantage. We hired sets of people for a reason, right? So we want those passions and gifts to come out, and we hired them for that. So this is why we align with this startup culture. Not that in the organizational or giant organizational culture, the individual passions do not come in play. It's not that. It's just the individual contributions are more impactful in a startup kind of environment and smaller teams. So this is the rationale for this one. And of course, we always emphasize in our team, we should be highly adaptable. We adapt to requests for courses, different courses. We adapt to changes in staffing, for example. And so this is how the mindset and the lens that we look at the team as a project manager. And I'm getting to the end of my presentation, but should you forget everything else, I teach epidemiology, and I always end with this at the end of the semester. So should you forget everything else, and if I may share an encouragement, being in public health is that each of us have a voice, no matter how quiet that is. You have agency, so use your voice. And know it is good early, especially those of you who are early on in your career, the sooner you realize that you cannot do it alone, the better, right? So collaboration is key. Know that you're a part of a system, and work on that. Work on your collaboration skills if need be, but it's best, bigger and better things happen when you collaborate with others. And then last but not the least is that public health is a long game. So keep your optimism, use the tools. Public health is very multidisciplinary. There's lots of tools, including the tools that we talked about this morning. And so with that, I would like to invite your questions. I will try to answer them. And I also wanted to show our different social media and our team email and our website here. Thank you.
Not seeing any questions come through the chat. Karina, thank you so much for giving us more information on this program. It's really great to hear about this work that's being done.
Thank you so much, Jennifer. I'm just going to type my email address here in case you can connect with me directly or with our team. In case you have questions later on, if you want to know more about the program.
Great, thank you.
Thank you, Jen. I hope I didn't go over time.
No, you are right. You have extra time.
Okay, great.
Yes, thank you.